We'll do our. All right. Well, welcome everyone. We are here. This is our Health Equity in Action, Libraries, Communities, Opportunities. It is a summit hosted by the American Library Association's Social Responsibility Roundtable, Roundtable or SRRT. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping to solve social problems and inequities to work for the common good. My name is Rachel Rosekind. I use she, her pronouns, and I'm joined by my colleagues April Shepard and Julie Winkelstein, who will be helping with today's session, running tech and moderating the chat. So thanks to them. Before we get started with our presentations, I'm just going to review a few housekeeping items. So to enable captions, you can click More in the bottom right of the screen, then click Show Captions. Regarding AI use, we are still having internal discussions about our AI policy. And while we're doing that, we're asking all attendees to please turn off their AI. If you are using AI for an accessibility need or have questions about this, please reach out to me privately in the chat or via email, and I will drop my email in the chat shortly. We will be recording today's session, as you probably just heard from the queue. We typically get our recordings sent out to everyone who's registered and also posted on our website within the next, within 2 or 3 weeks after the event. This session focuses on culturally rooted and community-focused initiatives to support Black and Indigenous maternal health. If you were with us a couple of sessions ago, you heard about some of the data behind Black and Indigenous maternal health outcomes. So this is another side of that story. Or lots of those stories. We are joined by an incredible panel, and we have 3 people, which include Tiara Davis, who is the Contra Costa, California Abundant Birth Project Program Manager. Tiara is a breastfeeding and birth justice advocate. She holds a Bachelor of Science in Public Health from Dillard University of New Orleans and a Master of Science in Public Health from the University of San Francisco. Lacey Warrior is an enrolled member of the Ninilchik Village Tribe, Dena'ina Athabaskan, is also Alutiiq and a descendant of the Aani Nation. She was born and raised on Coast Salish lands and has a deep love for her urban Indigenous community and has served the community in many different capacities over the years. Her specialty is in program development from a trauma-informed and healing-centered lens. And currently, Lacey serves as the Nest Program Manager with Hummingbird Indigenous Family Services. Daysha Gunther is mixed Yupik from Kongiganak and grew up in Western Washington on Coast Salish lands. Daysha received her Bachelor of Science in Public Health and Master of Public Health from the University of Washington. Daysha is passionate about data sovereignty and evaluation that centers community and culture. She sees her evaluation work as telling the story of how reclamation of culture supports community care and well-being. So we will be taking questions for the panelists after all the presentations conclude. So we'll have 2 different presentations. You can use the Q&A function to pose questions. You can do this at any time. You do not need to wait till after they've concluded. If you're having any tech issues or you want to share resources or appreciation for our panelists, you are welcome to use the chat. And with that, I will turn it over to Tiara. Thank you.
Thank you, Rachel. I'm going to share my screen and start going through these slides. Okay, so I will be talking about the Abundant Birth Project today. I'm the program manager for Contra Costa County, and the Abundant Birth Project was the very first guaranteed income program in the country for pregnant women. So you guys will be getting the background and all of this stuff today. So I'm just really excited to share this information with you guys. So about the California Abundant Birth Project. So this program actually started off as a pilot in San Francisco. That's where the ABP model was created. And it served 151 participants. And that was just a pilot to go over if the model works. And it does. So we were able to get funding for an expansion, and that's what I'm a part of. So the goals of the expansion were to test ABP across California with 950 moms. The second goal was to study and learn the impact of ABP's guaranteed income. Our research heavily guides our program, so we'll get into that a little bit as well. Another goal was to make the case that this should be something to serve all pregnant people who need it. And then lastly is to secure public funding for ABP. So right now the expansion is in 4 different counties: Alameda, me and Contra Costa, Los Angeles, and Riverside counties. And we are partnered in Contra Costa with Fierce Advocates. They are another nonprofit organization in Richmond, California. Ew. How this program works is every month for 12 months, Contra Costa participants get $1,000 monthly. This goes through pregnancy and postpartum. The money is unconditional guaranteed income. We'll go over what guaranteed income means as well. Along with the cash gifts that they get each month, we also offer optional abundance coaching, and that's just our special way of saying case management and connection to other resources and services. And our goal was to serve 120 participants in Contra Costa. We launched January 2024, and we concluded enrollment May 2025. So what is guaranteed income? Guaranteed income is providing regular cash with no strings attached and no work requirements. And there are actually studies that shows that guaranteed income leads to improved health outcomes. We got our study design, our idea from a study that was in Manitoba. It was a guaranteed income program for pregnant people as well. There was a 10% increase to the income through the participants in the program during their pregnancy, and that led to reduced preterm birth by 17.5% and reduced low birth weight by 21%. So how abundance coaching goes, once again, this is an optional service. They are not mandatory, or it's not mandated for them to do it, but we highly advise it because during our abundance coaching, they're able to go over their individual goals. This could be employment, financial, education goals. We are able to send referrals to other community programs within Contra Costa, and honestly, if they accept people in Contra Costa, we send them referrals everywhere. So we definitely grew our referral network beyond California, and that was essential to our participants' success. And if they do opt in for abundance coaching, there are 4 check-ins that they do, but they could check in whenever. However, we do virtual, in person. We can meet up wherever the moms need to meet up. We are going to them to give them the support they need. Some of the eligibility requirements for our program is they have to be between 8 to 27 weeks. And this is just because of our research and need to be in the program for a certain amount of time to show that that this was like effective to them. So by 27 weeks, they have to be enrolled into the program. We were accepting people 15 years of age and up. There are some income requirements, but we did not collect any like W-2 forms or anything like that. This was self-attested information as far as income goes. And one of the good things about this income is that it did not affect public benefits. So if they were in CalWorks, well, that's what it's, CalWorks is like a work-based program in California. Things like SNAP benefits, WIC, all of those kind of programs, this income does not affect it at all. So some of the health factors that they need to have at least one of the top 5 risk factors for preterm birth. The first risk factor that they can attest to is identifying as a Black pregnant person, having a previous preterm birth, having pre-existing hypertension, pre-existing diabetes, and have sickle cell anemia. So once again, they just have to attest to one of the 5 risk factors along with their gestation and location being in Contra Costa County. So our research, of course, we need to collect research so that we are able to get the public funding, which was our main goal of this expansion. So the research looks over different, how could I say this? They look over different potential outcomes or things within while they are in the program. And this was also for those that had applied but were not selected during our lottery. They were also able to participate in the research. Everyone that participated in the research, they got cash incentives as well. So those are even the people that were not enrolled. They were looking at financial well-being, food security, housing security, of course, birth outcomes and child health, maternal stress, mental health, perinatal and postpartum outcomes, well-being, hope and agency, and of course, educational outcomes. So those are all the things that the research looks through to see the outcomes of that could determine the benefits of the program. So some of the outcomes with Contra Costa County, we were able to distribute $1.4 million. We served 120 moms, and that led to 119 abundant births. We were able to get 72% of our participants to enroll in abundance coaching. And then we had 120 graduates as well. And throughout our program, we've been able to do over 10 community gatherings. Most recently, we were able to do our Black Maternal Health Week event. We had a really good show out with that. And we also had a photo shoot and self-care day for some of our moms as well. We're going to be using that for our outreach materials, but that was the day moms were able to get self-care. They got their hair done, they were able to get food, makeup, all of this stuff, and have a photo shoot with them and their abundant birth baby. Those are a few of the things that we've done. And I also wanted to touch on how important community collaboration was. We were not able to do this without the help of our community partners. In Contra Costa, we partnered with a program called Coco Doulas, that is a free Black doula program in Contra Costa, and they are also housed at Fierce Advocates, Black Infant Health, WIC, and Breast Friends for breastfeeding support. These programs we had good and strong referral connections with, and then we also were able to share updates on our upcoming events and theirs with our participants. And then for participant engagement outside of the abundance coaching, we had group interactions for community building, learning through support, educational groups. We had a series that was done once a month virtually, and we were able to do one in-person group that was a body movement workshop. We did that in March, so we were able to do that. And lastly, but I think most importantly, is sustainability. So since this program is sunsetting in June, we are actually sending out our last payment tomorrow. So 2 years in this program, we're sending out our last payment tomorrow, and we want to keep this going. So how can we sustain this program? And if you are interested, these are ways you can to donate to our project. Invite us to present to your board or request funds. If you know of other programs that would like to bring, I know you guys are all over the country as well, but if you guys know agencies in your states that will be thinking about having an Abundant Birth Project in their city, county, please reach out to us and just share our program around. We want everybody to know that things like this are possible and the positive outcomes that could come for people in your communities. And then I guess we'll do questions at the end, but that's the end of my slides. Thank you so much.
Thanks, Tiara. Yeah, this program has been so powerful, and I think we'll talk a little bit more about the great guaranteed income stuff that's going on around Contra Costa County and nationwide. That's fabulous. So, but next up, we have Daysha and Lacey. Please feel free to begin.
Hi, everybody. Go ahead, Daysha.
Yeah, hi everyone. Thanks, Tiara. That was so beautiful. I love the presentation, especially the photos. Um, we are Daysha and Lacey. We're going to talk about the Hummingbird Nest program and our perinatal guaranteed income pilot program. So we want you to meet our teams. Lacey, do you want to go ahead and take this one away?
Hey, hi, I'm Lacey. I'm the Nest Program Manager. Here we have Cami Goldhammer. She's our founding executive director of Hummingbird Indigenous Family Services. And we have Tia, our abundance auntie, which is like the coolest title ever for a case manager. Yeah, go ahead.
Great. And then we also have our storytelling team who we'll talk a little bit more about what they do later, but they're working on a documentary about this work that we've been doing, and that is headed by Sahi, Soli, and Jeff. And then our data sovereignty team is led by Tess, and then me, Daysha, and then Olivia and Koa are also on the team. And we're a fully Indigenous led team. All right.
All right. So the nest, this is our uh this is the first guaranteed income pilot to exclusively serve Indigenous communities and birthing people in the country. So over a total of 5 years, we are giving 100 up to 150 families $1,250 a month, no strings attached, until their child's third birthday. So we enrolled all of our 150 pregnant mamas. The requirement was after 12 weeks of pregnancy. So a lot like abundant birth, we wanted to be able to capture what the guaranteed income does for pregnancy into birth and into postpartum. This program was designed with community at the center, so really thinking through what this could mean for our whole community, the urban Indigenous community here in Coast Salish territory or Seattle. And we had a very the enrollment process was very low barriers. So we worked with our partner Aid Kit to make sure that this process was seamless for pregnant people so that the burden of paperwork and logistics was alleviated as much as possible. So what we did is enrolled 15 of our relatives, or who we refer to as our clients, as our relatives, 15 relatives over a 10-month period. It was through a lottery system. So once the applications were put in, each applicant received a unique identifier number. And then so every month, 15 unique identifying numbers were selected over that 10-month period. And we worked with various community partners to implement the application process. So Seattle Indian Health Board, Pikawa, Pacific Islander Community Association in Washington, and United Way, and a few other community partners that we work closely with to help us with the application process, because we did receive hundreds of applications for being part of the nest. So. And then we also do offer additional optional programs. So this is a no strings attached with the option of programs. So next slide, Daysha. Like I said, some of our partners of the Nest are Aid Kit, Pikawa, Seattle Indian Health Board. We also partner with Leap Fund. When we did our enrollment process, we worked with our relatives to discover if they would be facing benefits cliffs based off of the addition of guaranteed income. And we're able to coach through thinking through what this guaranteed income would mean for their public benefits that they may have been receiving. So SNAP benefits or TANF or things like that. And thinking through all of these processes, we work with our cultural advisory council. They represent our community. So they're leaders who have been a consistent voice and advocate for Indigenous community. They serve a number of roles within Hummingbird to provide cultural knowledge with Hummingbird staff and our relatives that we serve. So, and supporting our program planning and making sure that community and culture remain an integral part of Hummingbird. They were very key, they had a key role in developing the nest over a long period of time. So, yeah, hold on, next slide. So some of our offerings of additional programming are, the first one is Indigemoney, which is a financial empowerment program and training for relatives. It's developed by myself and Tia after we went to a financial literacy training, train the trainer training. And we kind of switched up the language to financial empowerment versus literacy. And we know that Indigenous people, we've always managed our resources wisely, whether it's catching salmon, harvesting wild rice, herding sheep. Yeah, we know how to manage our resources. And so this curriculum we designed to help our community adapt our traditional skills and our traditional Indigenous knowledge into the management of just another resource, which is our financial resources. We've had a lot of engagement in Indigemoney and seen a lot of really beautiful things happen after that training. We've had one family realize that they had more resources than they thought and were able to buy a home. After renting for years and years, their whole lives. We had another family who opened up their own business, a food truck. And so we've seen a lot of beautiful things happen from that program. We also offer in-person and virtual for Indigemoney. So that's just to enhance the access to this additional program. Next slide. Yeah. We have
wash your phone.
okay. Sorry, my son is here. We also have 6-month check-ins with our relatives. So they schedule time with Tia and that's okay in a minute, buddy. These are in person. They can be a text message, or Tia loves to come and meet up and have lunch with families. It's really whatever is going to be best for our relative. Here, now wipe it. And however they want to interact. And these check-ins are really to just ensure that they're receiving the payments. There's no hiccups with all of that, and to provide additional resources and support. And then also to communicate all of the other ways that that our relatives can interact with Hummingbird in the form of our cultural programs, like our medicine making workshops, cradle board making workshops. We do drum making and gourd rattle making, all kinds of additional cultural programming that really speak to the cultural health of our relatives. Other resources available are, we have at Hummingbird an abundance fund that is, when our families are facing a crisis. So if they're utility assistance, eviction prevention assistance, those kinds of things can be accessed through the Abundance Fund. We have our birth keeper and home Pili Makuta home visiting program, which is our birth keepers are our doulas. So a lot of our nest relatives receive those additional services. We also have a hold harmless fund. So if our relatives did experience a benefits cliff from the guaranteed income, they're able to offset the loss of any like SNAP benefits based off of hold on, sir, based off of other losses that they've had. Right now, baby, just wait a minute, okay?
Please.
I can't right now. We also have our Indigenous emotional support, our emotional wellness besties. So, hey, give me a minute here. He wants to read a book. Um, and that is for our relatives who experience perinatal mood disorders, and their peer support. So they also did experience perinatal mood disorders and receive support that way. In this picture, you can see Tia, and this is my daughter Hazel in the picture. Please wait. Next, following this side. We have want to express a lot of gratitude.
Sorry, it went very far ahead.
Arlo, please wait. Please wait. Another program that we have through the Nest is our Indigenous Voices Leadership and Professional Skills Development program. We have a cohort of about 5 to 7 folks per year who are Nest relatives. Yes, one moment.
Zoom does a really great job at filtering because I can hear it on the other side in the office what's happening. And before Lacey muted, I Zoom.
So Indigenous Voices, we have 2 to 3 workshops per month. Some of these are virtual, some of them are in person, and these go from like resume writing and speaking, public speaking, all the way to restorative practice and emotional and self-care wellness workshops. So this culminates in some of our relatives coming to the Basic Income Guaranteed Conference. And last year we had, I love this picture of our whole group, but we had a couple of relatives come and speak at the Guaranteed Income conference about what it did for their lives and what it's doing for their families. So that's always a really fun way to kind of round out that program. Next slide. Next, I'm going to talk a little bit about our storytelling project and program. The first component of it is our artist residency project. It's funded by Robert Wood Johnson Foundation, and our artists and residents work closely with our Nest relatives by facilitating workshops to create art aligned with traditional and cultural values, both of pregnancy and parenting and narrative change work. You can see on the left here, Sandra Segundo was our first artist in residence and wrote a book about all of our nest babies and used language from all of the different tribes of the babies who were at that event. And she also wrote a song for our babies in Tlingit, the Tlingit language. So, currently, Malia Peoples, who's Kanaka Maoli, is our artist in residence. She's doing a lot of kapa making with our Pacifica families. And Elise Bulgarish, who's Muckleshoot, provided workshops on plant medicine. Me and my kids came to the drum making workshop, which was super fun, and just that cultural connected and wellness that our nest relatives experience gives that abundance of it's an additional abundance of wealth, that cultural wealth that they get to experience is really lovely. Next slide. The next part of our storytelling project is the documentary. So we have a few families. It's an episodic series that are documenting the lives of three or four of our relatives. So you can see some of the relatives here that we're serving. And we premiered the first two episodes back June in 2025. A really, really amazing turnout that the whole community came out to learn about the nest and guaranteed income and learn about the relatives that we're serving in all of the different cultural practices and communities that our relatives come from. And it was amazing. And so this project is going to be lasting over the entirety of our pilot. And so we can let you all know and keep a lookout for additional docu-series episodes. The most recent episode follows one of our families very closely, and it's a really beautiful to see this mama and her baby really not just surviving, but thriving in their culture because they have nest guaranteed income and have that space to experience and partake in all of their cultural practices and ways of being. So yeah, that is our storytelling program.
Great. Thank you so much, Lacey. And now I'll talk about our baseline report. So what we'll share today is just a few highlights from what we found in this 86-page report. I will share a link to that full report so that you can check it out if you'd like. I'll do that at the end of our presentation. So we also had 151 participants in our GI program, and almost half of our nest relatives chose to participate in the evaluation because we really wanted it to be, no strings attached, basic income. So they didn't have to participate if they didn't want to. And the methods we use, so it's a longitudinal mixed methods design, and we collect surveys and interviews at 4 different time points. And so this happened around pregnancy and postpartum, up to 6 months. So that's our baseline report here. We are still collecting data from when the child turns 1.5, and then at the 3rd birthday, and then 6 months after graduation. And data sovereignty and community. So community embedded mixed methods analysis has been a really big priority for us and our team, and it really enriched the findings. And we saw so much complexity come out of doing mixed methods data and mixing the ways of knowing. And perinatal care, mental health, historical trauma, and cultural connectedness data narratives, they really warranted so much reflection and care in this analysis from what people were sharing in these really deeply personal stories. And this picture on the left is from a quarterly community dinner that our Fireweed Cultural Connection Program hosts. And we had a data station displaying some nest findings. And we wanted community feedback on it because we were seeing some discordance between the survey data and the interview data. And we really needed help understanding what was going on. And so we feel really lucky that we can work so collaboratively with programs across Hummingbird and really embed this kind of data work into all areas of Hummingbird. Okay, nest experiences. So when the nest program was being designed, the team asked, how can we create a space where Indigenous mamas know that they are enough? Just by your very existence, you are enough. And so what we really saw in this evaluation is that the thoughtful, community, and culture-centered approach to designing this program really impacted the experiences that our families were having in it. And so from our baseline survey, we saw that over 97% of NEST participants reported a positive or very positive experience in the program. And we know this like overwhelmingly positive response is a result of the program built on being community-centered and run by people who are from the community, who are trusted by them, who know how to meet our relatives where they're at, and really create a warm and welcoming environment. And one of our participants said about the program that it does change your life for real, for the best. And we had another participant say that that's what makes the Nest an amazing program. We will raise our children. We will take care of our children because we don't need to worry about many other things. It's important to be with them because nobody will teach them our traditions, history, or culture better than us. So yeah, what we really found was that what our participants most appreciated are these community and cultural-led approaches. And we think it's just so important to like continue to highlight that and hammer it in that, especially as more communities and institutions start their own GI programs or are scaling programs, centering community, centering culture is such a key thing for what is going on at the Nest and what we're doing really well. And okay, so some survey results on income and financial needs. So our relatives had a high level of financial need coming into the program. And they answered questions around where they might need more support during pregnancy, and that was around basic needs, child-related costs, and health services. And so what we found was the top categories where more support was needed during pregnancy was purchasing baby items, food, clothing, utilities, and housing. Do you want me to open this? And we have some great quotes from this too. From the interviews, we heard that the Nest helped the whole family. We faced several challenges. My husband lost his job. We didn't get much help from the welfare office because of his last paycheck. So the Nest program helps us pay for bills, helps us stay housed. We didn't lose our rental. We were able to pay our full rent and then utilities. And then I was going through health issues and it supported all the medical bills. It really like supported this family's stability. Another participant said the Nest income helps us to get gas, to get to appointments, food or clothes, shoes, events. We get to go to the powwow, stuff like that. Even getting an older child in sports. Oh, I need my track shirt. I need choir. She's in a lot of events, and if she wants to do more sports, we can sign her up. But back then we couldn't afford it. So we see all these basic needs are being able to get met in addition to being able to attend cultural events, and then also children being more embedded in their school community and activities. And it's just such a beautiful thing to hear about. We also had asked our relatives about breastfeeding and chest feeding and feeding their babies. And the Nest income was a big support for infant feeding. Formula costs quite a bit of money. And it also, the Nest was helpful for those who had chest feeding goals by providing financial security to take time off work. We heard of a few parents that were able to extend the leave that they took to be able to support doing that. And the Nest income was also supportive of autonomy in general. And one relative said, it just makes me feel nice being a provider to a little human for their food. That's the great part of the Nest, I think. The whole doing it on your own terms, but also getting that support. And then we also asked about perinatal care and birth experiences. And what we saw in the survey results were that our relatives rated their prenatal care and birthing care experiences as generally pretty good. Like there's a lot of positive, very positive and positive experiences. But in contrast, we were in the interviews, we were hearing like a much more nuanced picture. And what that's kind of what I referenced in the earlier slide, right? We brought this data to community to get help to understand what was going on in the discordance between the survey and interview. And the community input highlights that survey desirability bias and complex feelings around guilt and gratitude when an imperfect birth experience results in an overall healthy birthing parent and baby likely play a role in our quantitative findings. And this one participant told us, then my husband came in and he was all gowned up and I was really scared. It was so scary. But once I heard my baby boy cry, it was like it didn't matter what I was going through at that moment. He was alive and he was safe and he was here. And that's all that mattered to me. And we also asked about perinatal mental health. And we were seeing that the nest was having an impact here. One participant talked about just to know that we have that income no matter what is a big difference. It also takes a lot of stress off our shoulders. It kind of puts my mind at ease, and it's really just been amazing. We heard a lot about, you know, removing financial stress was hugely important for our relatives' mental health. And then we also asked about cultural connectedness. And this is something our community really wanted to measure through this program was the relationship between GI and cultural connectedness. And so we used the cultural connectivity scale from California to measure around traditions, identity, and spirituality. And families reported on the importance or presence of each cultural connectedness factor in their lives. And so the most commonly cited aspects of cultural connectedness under each subscale. So for traditions, it was being close to family or someone who attends cultural ceremonies or activities, which was reported by 68.5% of our participants. And then for the identity subscale, a desire to learn more about one's Indigenous culture was reported by over 3/4 of our NEST participants. And then for the spirituality subscale, believing in animals, rocks, and all nature have a spirit was reported by 68.5% of our NEST participants. And really through like genocidal practices like displacement and the resulting historical trauma, we see a lot of urban Indigenous people with a desire to like really reconnect with culture. And we see that it takes, a little bit more than money to heal these wounds. And so centering culture in the work that we do gives our community opportunities for reclamation and healing. And there's so much more on this in the report, which I have a link to. You can scan this QR code and I will also put it in the chat in a moment. And we also just want to express gratitude and acknowledge everyone who helped contribute to this work in this report. Of course, our relatives, our partners at the University of Washington, Indigenous Wellness Research Institute, Tino, Soli, and Emily, who helped with the report editing and design, the Perigee Fund, of course, and our Community of Evaluation and Data Advisory Relatives, or our CEDAR Council, our Cultural Advisory Council, and our Clan Mother leadership. Of course, our Hummingbird staff, Patanjali and Martel, who did a lot to get this program off the ground, and our Mother Infant Cash Coalition friends and collaborators. Great.
Thank you. Thanks for those powerful presentations. Just such incredible work. Full disclosure, I am also a guaranteed income evaluator and do some of the same work that the panelists do. So I believe mightily in this work. Would love to hear from our attendees. Any questions? I don't think there's, let me double check the Q&A. I don't see anything popped into the Q&A. yet, but hopefully folks have questions. Maybe I'll pose a question to start us off, and then maybe it's a lot of information to take in, because guaranteed income in and of itself is kind of a radical concept to a lot of people and pretty diametrically opposite to our public benefits system. So I'm curious if you could just speak to when you all developed these programs. We were in a different landscape in terms of how people viewed racial justice and equity-based work. There was a lot more positivity around it and acceptance around it, not from all quarters, but it was being funded more robustly, and also just it was a different landscape politically. That's shifted, as we all know. And so I'm curious, how and whether you've had to shift your work or your strategies in the past couple of years. I know a little bit about what Tiara and the Abundant Birth Project had to do, so maybe you can share that with us, but also curious with Lacey and Daysha, like how you're navigating today's landscape.
I can start. So our focus right now is really just trying to find those little pockets of money that we could go after to continue our funding. And then also meeting with any politician that would hear us talk about the program and just gain momentum that way. But yeah, like you said, the environment has definitely changed. We were almost at risk of losing I think it was around $5 million for our research. But thankfully we were able to keep it. But essentially sustainability is just going to be around looking for little pockets of money within California social services, Medi-Cal benefits, any kind of spots that we could stick in like that and continue this, even if it is on a scale of just doing another expansion in other counties, as opposed to the statewide initiative that we would have liked, just to keep it running until the environment is different and more, accepting of programs like this.
Yeah, we've been really lucky at Hummingbird to get a lot of private funding. So we haven't had to navigate too much of the challenges around the changes in government and how they are viewing this kind of work and valuing it or devaluing it. And I think our team, like everyone, is pretty involved in kind of beating the drum to like find more funding, and like, yeah, we all have at least, one pinky, and like, how are we going to continue to get more funding?
I do want to add a little bit more, since the sustainability part is heavily on politics and who's in office and things like that. We have opened up a space for our participants to join in on the policy as well. So we do a lot of learning from them and them learning from us so that they could share in community as well. So just little efforts like that are some of the things that we are doing to continue ABP.
Yeah, that's great. And I know for our program, the program that I'm involved in, which focuses on student parents and a few other populations, we're doing the same thing where we're helping them become, improve their advocacy skills and get into spaces where they can talk directly with legislators and policymakers and decision makers. So it's really important. Okay, let's see. Oh, I do see some questions in the chat and the Q&A. Okay, so just looking at the chat right now. So any challenges or successes, this is for everyone, any challenges or successes that you did not expect and would like to share with us?
I think the biggest, well, not the biggest, I'm not going to say the biggest, but one thing that we found when we were enrolling families is that when they first heard about it, they thought it was fake. They thought it wasn't real. They thought, oh no, nobody's just gonna give me money just for existing, right? And so I think that's like one of the fun things that we get to do when we enroll people and mamas in this program is like, and it helps to us instill like you are enough simply by being you, and you deserve this because you are you, and it's not fake, it's real, and here it is. I think that's one thing that I love to one of the stories that was that unexpectedly came from this work that I love sharing.
That's so funny you say that because we had a bunch of applicants thinking that it was fake and they didn't really believe it until they got their first deposit. That's when they were like, okay. But another challenge that we had to navigate, especially during the enrollment stage, was how to process applications that may have seemed fraudulent. So we did get a lot of fraudulent applications. You know, which is understandable because we're giving away free cash. So we had to structure our application review process a little differently. And we also did that with the help of our community governance board. And that's the like group of community that we have that helps structure the program. So we have members that have been helping ABP since 2019, and they're still with us now in community governance. So they were a part of that. Um, and then also, it was a little bit of a struggle to get people interested in the research. Outside of us having a cash incentive as well for them doing their research and surveys, um, especially the control group because they weren't in the program. So we kind of lost contact with them. So we had to come up with new ways. Well, the research team had to come up with new ways for that data to be collected from them. But overall, challenges, you just have to be flexible. We were flexible throughout the whole process, and even now we are in it in 2 months. So it's just being flexible. But the success is um, just seeing the benefits that the moms were able to have because of the money. Moms were able to actually take care of their families and themselves. They were able to do self care, getting their hair done, getting massages, doing things like that for themselves that leads to healthy pregnancies. So that was definitely some of the successes we saw.
Yeah, I love that. One of our moms got to join a gym that had childcare, and so she's able to now care for herself and also have her care for her son. So yeah, amazing things. Okay, I see a few more questions, so I'm going to go to the Q&A now. And, Daniel has a question that says, how does health insurance status impact expectant participants in these programs? Do you help them navigate finding health insurance options or providers who will take what insurance they may have?
So as far as insurance go, as far as getting into being a part of our program, that's not something that we screen for. But if we do have partners where that's a need, where they do need to get their what is it, Medicaid for everywhere in the country is called Medicaid, right? Because in California it's called Medi-Cal. But if their Medicaid lapsed or anything like that, we are able to connect them with financial advice. Well, what is it? Yeah, financial advisors and counselors with Medicaid to get that situated and connecting them with providers as well. We were also able to make strong connections with a bunch of different health systems in Contra Costa as well, so that they were aware of our program and our referral process. And that was something that was kept strong throughout, just keeping them updated on new procedures, how we can get moms enrolled in time, especially with the time limit of 27 weeks. It was a really critical point when they started the application at 26 weeks. They only have a week to be able to be a part of the lottery. So, yeah, I hope that answered the question.
Yes, and for the nest, the health insurance was not any like information that we collected for eligibility and in the nest. However, if we did come with a relative who needed help navigating that system, they did work with our abundance auntie and or a birth keeper that they might have been enrolled with to make sure that they had access to all that information and those resources. We did have some of our nest relatives come through, do their applications through the Seattle Indian Health Board. And so their case managers at the health board can also help them to navigate health insurance systems as well. So, yeah.
Thank you. So we have a couple questions about, we have somebody who did collaborate with Abundant Birth, who is a hospital librarian, but then a broader question about any collaborations with libraries of any kind throughout your programs.
Definitely in the right after we launched, so in 2024, when we were doing a lot of outreach, we were able to meet with the Contra Costa Public Library. So they were aware, and I believe even some of our flyers were posted in there, and we were able to get some tote bags and reading books and stuff like that to hand out to the moms. So yeah, I can't speak for the other counties, but we definitely made sure that Contra Costa libraries were aware of our program.
I'll say something to that, which is if you would like to present at the Contra Costa County Libraries, any of your moms on the findings, let me know because I work with them closely and could make that happen. So just to that, Daysha or Lacey, did you work at all the libraries?
Prior to enrollment or during enrollment, I believe some of our information, like much like VP, we had flyers and a lot of different places to show the availability, but we did rely heavily on our community partners like the South Pequot and Seattle Indian Health Board to make sure that folks knew about the opportunity. But currently, maybe Daysha, you can speak to like the findings and what we might be presenting to libraries.
I don't think we've formed any partnerships yet. That's a great idea. We are working with the University of Washington to get their library access to research. And like, it's this partnership where we are presenting the work we do at Hummingbird. And it's about getting marginalized communities more represented in clinical research. These kinds of partnerships like are really on our mind for data sovereignty to like have more access to data and studies and yeah.
Yeah, and Seattle Public Library is very focused on like a lot of equity issues. They do great social justice related programming, so definitely reach out to them. Okay, any other check again? It's like anybody else have any questions? Okay, I'll pose one more. I have my lessons learned question because these are new programs and your programs in particular, and actually most of the guaranteed income programs are put together with a lot of integrity and care and thoughtfulness. And as you said, they're kind of being flexible throughout to tweak things as needed according to participant needs. But now that you've gone through, almost an entire cycle, what are some overarching lessons that you might apply if you're fortunate enough, and we hope you are, to find sustainable funding to run it again?
Some of the things that we learned is the importance of working with a platform that can sustain what needs to be done as far as communication and stuff. There were a lot of technical issues that kind of made communication and payments and stuff a little difficult. And then also what we learned is, I think I want to just emphasize the importance of getting participants involved in initiatives like this, because their experiences and the power of their voices is what pushes them on. So I think leading with storytelling and stuff from the very beginning is something that we could have done. Fortunately for Contra Costa, we were able to get some grant funding specifically for storytelling. So we were able to collect some stuff that way. But doing it on a larger scale and maybe even including incentives for that as well. In this work, incentivizing everything is how you get the numbers that you want. So that's one thing we took away as well. Paying them for their time and their experiences is really important.
Yeah, along the lines of that storytelling, I think is super important. We know that we tell our stories best, and trying to change the narrative around guaranteed income and what that means for community is really important, that it comes from our own communities and from our own relatives and participants. So in the same line as that, what we've learned is that the guaranteed income coming from a culturally rooted organization is super important, because it also comes with that community and culture connection. And we know that the studies that show that guaranteed income works and it does what it needs to do, but for people who come from BIPOC communities, it's really important that that culture piece is part of where that comes from, the guaranteed income comes from, because you have such larger and more beneficial health impacts, specifically tied to culture, like our relatives who seek additional places to learn language, our relatives who come because they've got guaranteed income and they are not worried about paying their rent, and so they have the mental capacity and space to reconnect with their culture. So I think that is one of the key indicators of success of any guaranteed income pilot or program.
Yeah, Daysha, did you want to add anything or on that?
Yeah, just more focusing on data and research and evaluation. I would say a big lesson learned is, I've been with Hummingbird for a little over a year. And a lot of people have a lot of distrust in researchers and evaluators and people coming to collect data, which is like very understandable, especially people from BIPOC communities. And what was like really stood out to me was being able to do this work like with a lot of autonomy and like doing it in a culturally centered and rooted way. Like there needs to be reciprocity, right? So incentives and valuing people's time and experience and knowledge, but also like when we were doing that data activity at the dinner, we had an arts-based activity too, where the parents were collaging about what abundance looks like to them. And like people had such a good time with it. And they're like, wow, I never get to like sit down and like just have time for myself and like get to engage creatively in this way. Like I don't have a lot of time for that. So what's been on top of mind for me like throughout this last year is like it has to be reciprocal. And that's how we gain trust and repaired the harms that have been done through data collection in the past.
Yeah, absolutely. All of this is so core to the guaranteed income movement, and also like showing all the different dimensions of health and well-being, right? Like it's all of the things that we're talking about. It's not just, it is giving people guaranteed income, unconditional money, so that they can do all the things that they wouldn't otherwise be able to do, but it's all these other like cultural health and connectedness and mental health and creative growth and opportunities and all these things. It's pretty incredible. And the research piece, I just want to highlight for academic librarians who are here, you could learn a lot from the research being done on guaranteed income because it really does uplift trust and reciprocity and respect in a way that I've been a researcher for decades and it is not widespread across many different fields. So it's got some really valuable instruction and insights there. Let's see. I think, let's check the time. We still have time. If anybody has, probably have time for one more question, or I will give it to the panelists if they want to share any last things they didn't get a chance to say or ask one another anything in this time. We have a few minutes before we have to wrap up.
I would like to let you guys know, even though this part of the expansion is ending in Contra Costa, Alameda, and Riverside counties, we are launching in 2 other counties in California. So that's really amazing. It's still to be determined when that will be, but that is definitely something that is going to be happening. So we're still keeping it going. We want to make sure that ABP remains present in California because it's needed. So that's just some news I wanted to share.
Amazing. I love that. And then the county is also kicking off or just launched 4 other guaranteed income pilots for former foster youth, people returning from incarceration, families who are economically marginalized, and then older adults. So we're actually doing some good stuff in Contra Costa and spreading the word. All right. Any last words? I will close us out then. I have my little spiel I have to give in the end. First of all, hearty thank you to our panelists and also to our attendees and to April and Julie for their assistance. We could not do any of this without our members, and we do all of this for free. So we are committed to ensuring that CERT's programs are diverse, inclusive, and free. We rely on support to do this from the American Library Association, membership, and direct donations. We invite you, if you're able to help champion our roundtable's mission and our commitments by donating at the link, and Julie will drop these links in the chat. There's a donation link, or by joining CERT as a member. You can make a general gift or select the specific CERT task force or award that you'd like to support. We really value being able to bring these free public programming to everybody. And to do that, we want to maintain our high quality program, the core values that sustain it, and our commitment to accessibility. So if that is available to you, please help us out. Our next session begins at 3:30 p.m. Central Time. I have to do quick math because I'm in Pacific time. I think that's like 20 minutes from now. And that will be information access, health, and safety in the age of targeted legislation. So it's going to be another great session. Hope you can join us. And we have one more after that about access to healthcare or lack thereof in carceral settings. And that's our last session for today, and then a full slate tomorrow. So thank you again for joining us.